is that pretty well controlled as far as, do you take your blood pressure regularly?
No, not really.
That's okay. Let's see, any allergies or food sensitivities? Alrighty.
So, when she gave her medical history, it popped another. So, all right, so just based on her story, what is y'all's differential diagnosis? So what do you think is going on? What's causing her main problem?
The burning gives me like nerve pain, and the radiating down also kind of gives me some type of like pinched nerve, slip disc, something of the sort maybe.
So she is, yes.
Would call it quantum
That's exactly that's number one on my differential. It's a neurologic emergency. Her bathroom problems. And then, but going back to, because when she mentioned atrial fibrillation, this could also on my differential would be a spinal cord stroke. So going back to the history, I'm not sure if you asked this. I always ask what is the context in which it happened. So what led to her fall? Was she just suddenly weaken her legs? Like 1 minute she was climbing the stairs and the next she fell because she couldn't move her legs? Or like what led to the fall? Was she dizzy? Like gain the context of like what led to everything. But ultimately I think that would be number one on my differential as to the chief complaint as of right now. But the exam will tell us more. So where do y'all want to, so we're going for a focused neurological exam. So where would y'all want to, what do y'all think? First of all, localized to what's going on. Like where else could it be? I think it's probably called Aquinas syndrome, but where else could it be? Bilateral leg weakness and trouble defecating.
Lumbar spine, or maybe like thoracic.
Yeah, either thoracic or lumbar spine. And again, the exam will tell us more. And I can talk more about that as we go through the exam. But that's where I would, so for spinal cord exam, your sensory exam is going to be very important. Your motor exam, reflexes. So yeah, you'll examine her. But still, you would do everything. But that would be where you're focusing, right?
I really don't. I mean, where would I start with?
So I would always, when y'all rotate with us next year, you'll see our note template for the neurological exam. I typically just go straight down that template, which is cranial nerves. So just general, like general neuro, like orientation, language, and then cranial nerves, then motor exam, sensory exam, reflexes, and gait. And I wanted to mention something before we even started. So in neurology, you can tell a lot about the patient just observing them, watching her when she walked in the room. That gives you your gait. You can see how she's walking and describe your gait right there, and it kind of, you can pick up a lot just from observing the patient and talking to them. But yeah, I would do like the brief things all the way up to like motor, and because if I'm focused down here, the cranial nerves, I mean, I want to check them, but I think something's going below. Does that make sense?
Sorry. So I guess, like by asking for like orientation, is that something like you just ask like the name, like day of the week type of like?
So I typically ask, have them tell me their name, the year, the location, and situation.
Okay. Great. Well, good morning. My name is Maggie. I'm another student doctor working with the team. I'm going to be going through some of your neurological exams. So can you tell me your name again?
Simone Carlton.
Okay. And do you know what year it is right now?
2023.
Okay. And then where are we right now?
I'm in the emergency room.
Okay. And for what reason?
Because I'm having trouble with my legs.
Okay. Perfect. And so then we would do the cranial nerves. So okay, I'll be
always start with eye movements.
Okay.
Do you just want me to run through it?
No, go for it.
So, eye movements, you'll check cranial nerve 3, 4, 6. Iris pulsing. Can you look right here at my finger? And then now just with your eyes, follow my finger. Look all the way this way. And all the way this way. All the way up. And all the way down. Good. And then I'll check their pupils if you have a. So I'll have them. Do you mind removing your glasses for me? And then you want to check each eye individually. And then you'll check do the swing and flashlight test to look for like a relative apparent pupillary defect. In her case, it's not going to be something I'm going to focus on, but still tell everybody. And then you can check visual fields, cranial nerve too. You should cover each eye and then have them, can you look right here at my nose? And then tell me how many fingers you say.
1,
How many now?
2,
How many now?
5,
And how many now?
2.
Good. And then you would just repeat that on the other eye. And then can you give me a big, big smile, show me your teeth? Good. And then when I touch your face, does that feel the same on each side or is it different?
Feels the same.
Same, good. Can you stick out your tongue, move it side to side? And then one more time, and then stick out, say, and then I'm looking for palatal rise, that's cranial nerve 9. If there's asymmetry in the palatal rise, that may tell me something's going on right here. And then can you shrug your shoulders up? Don't let me push them down. Good. And then you can check, showing your face. Good. And so yeah, that's your cranial nerve exam. I'll let you do motor exam.
Yep.
Okay.
I'm gonna test some of your motor function now.
Okay.
And so for this, is it doesn't matter what order or just kind of like?
So I usually do, just go from neck down, so upper extremities first. I have them, I usually ask for McChicken wing. And then you'll, so have them hold your arms up and then don't let me push down. Keep them up, good. And that's checking your deltoid. And then I'll have them, can you bring your arms up like this? And then you wanna check each side individually. And remember, like in neurology, symmetry is very important. But you wanna stabilize the proximal muscle group. And then I'll ask them, can you push me away from me? Push, 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 good. And now pull me towards you. Pull, 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 good.
Okay.
That's it.
Can you, push towards me? Or I guess.
But oppose her, yeah.
Okay.
Like, have her push against you.
Okay.
Good.
Can you push against me? Okay, and then can you pull? Okay.
Good. And then, I'll have them, you just make a fist and then stabilize here, and then make a strong fist, don't let me push it down, okay?
Okay.
Good, and now push me down. Good.
Okay. Can you push against something and then push down against?
Good. And then, lower extremities, check hip flexors.
So something kind of stabilize and then ask her.
So in the emergency room, yeah, but there's not, you would stabilize, not really for hip flexion, or like flexion extension.
Can you press or pull up against my hand? Okay. This side, this one.
And then here, I would have them, can you kick me away from me, push away, good. And now pull me towards you, don't let me straighten your leg. Strong, strong.
Okay. Can you pull against me?
And then push.
And then push this in.
Good. And then, can you step on gas? Good. And then can you cock your foot up, backwards, and don't bring it, yeah, and then don't let me push it down.
Okay.
Good.
Can you press against one and then?
Good. So, her strength is intact. But say, somebody came in flaccid paralysis in the legs, good strength in the arms, that just further localizes to where we're thinking. And then sensory exam, do, again, from the neck down, so you wanna do it, so spinal cord pathology, you wanna do like a very focused sensory exam. so that includes, light touch, it includes pinprick, so the pain temperature. You can check temperature, I usually just use the tuning fork and check to see if that should feel colder. And then check vibration. For vibration, you always wanna go on like a bony surface, so you can pick like here, ask them if they can feel it vibrate, and again, symmetry is the most important, so. And then, you can check proprioception. We can run through it all as we do it. So, but for sensory, you wanna do light touch, pinprick, temperature, vibration, and proprioception. And again, I just start from the neck down again. So, do you want me to start? Okay, I'll do, and I don't have a pinprick, but, okay, we already did the face. So, can you feel me touch your
Yeah.
arms? Does it feel the same on both sides everywhere?
does.
Okay. And then, pinprick, I would, yeah.
I have a microfilament on the end of this, but.
Usually I have,
Actually, there may be one in the base of your tromner.
yeah, that, it's not,
I know it's not.
yeah, but it's,
Want.
normally I would have a safety pin, and I would have it just come up here. Spinal cord, you're gonna wanna be like very thorough, like your dermatomal. But generally I would just compare, like, does that feel sharp? Does that feel sharp?
Yeah.
Same on both sides?
Both sides.
Okay. And then how about, what do you feel there? Is that
Cold.
good? And how about here?
Cold.
Same? Okay. And then I would check here. And then, for vibration, you can, usually start distal, because that will, some patients will present with like a length-dependent neuropathy, and you'll catch that. If you just check here, you'll never know if it was down there. So I'd go distal and then up, but if she can feel it here, I'll stop it right there. Can you feel that there? What does that feel like?
Vibration.
Good. So does it feel the same here and here?
It does.
Good. Okay. And then for proprioception, you can, I'll typically have them, so I'll go to the distal phalange joint and then have the patient, can you close your eyes for me? And then I'm gonna move your finger either up or down.
Okay.
So this is up, I always give them, like, tell them, so this
Yeah.
is up, this is down.
Okay.
Okay, so tell me which way I move it, so.
Down. Up. Up. Down.
Good, so proprioception, just do the same on both sides. I think that's everything, yeah.
You don't want to feel that?
So you can just do the legs,
I was just,
yeah.
okay. So, you're gonna touch your legs, as long as you feel both the same on both sides.
I sort of feel it.
Okay, I'm gonna do one by one. I'm gonna feel that there.
Yeah, you're touching.
I am. You can't feel that?
I sort of feel it,
Okay.
you know.
Maybe not as hard as you did.
Yeah.
What about on this side?
It's the
It
same
feels
on
the
both
same
sides,
Okay.
yeah.
So now do up here.
Okay.
You wanna notice in her whole leg, is it,
Okay. Can you feel that?
I
as well?
can feel
You
that,
what
yeah,
about on
and
this
that
side?
too.
And then does it feel the same on
Yeah, it
both
does,
sides?
it
Okay.
does, I hear.
Okay.
okay, and then you can.
Okay.
Yeah. Yeah.
Okay.
Okay.
I'm gonna start then. Tell me, does that feel short?
Not really
Not
sharp.
Okay.
I know you're doing something, but it doesn't feel sharp.
Okay, what about on this side?
It's same kind of feeling.
Okay, what about it?
It's sharp.
It's sharp.
And that's, yeah. Mhm.
Okay.
Mhm.
Okay. Is it okay if I lift the bottom of your?
Yeah, you want me, oh, my pants, yeah, let me take my shoes off.
For now, it's fine.
Okay.
What does that feel like?
Sort of, I don't really,
Okay,
just sort of feel it.
okay, what about on this side?
It's the same thing.
And then obviously I really put it on her skin up here, but what did that feel?
That feels cold.
Okay, and what about on?
Cold.
Okay.
if they can't feel it, then you want to go. So the next, can you feel it?
Barely,
How about here?
barely,
Does it feel the same on this side?
yeah, I guess.
Okay. And then you could do proprioception. But it's pretty much out to all modalities right now. And so what information do we already have that checks, do we need proprioception? Did we already check that sensory tract?
That's a very,
Yeah.
like, very
Yeah.
attractive, yeah.
So yeah, but if you did need a proprioceptive exam, like sensory exam in the foot, I would go turn big toe. Okay, so reflexes.
With sensory, do you always want to do ankle and knee, or do you only do, like, go up to the knee if they can't feel an
Yeah,
ankle? Okay.
So reflexes, I'll do the right, you do the left. Okay. So we'll start here. And so for your biceps reflex, you can pick out the tendon here and then just kind of get your finger there. And you can feel, I can feel it more than you can appreciate it. For brachioradialis, just go to the muscle bulk here. Right there. And then triceps is a harder one, but you can feel the tendon there. And then when checking reflexes, so you want to let the hammer do the work. Don't like hit it like a hammer, let it like kind of swing like a pendulum up there. And that just makes it easier to listen. And
Can I do it with
it
this
takes
hand
practice,
and like,
yeah.
okay, because I feel like I'd be better.
And then, so what we are really interested in is lower extremities, right? So what would y'all, if somebody's coming in with cauda-equina syndrome, what would you expect the reflexes to be? In a hyperacute thoracic cord injury, what would you expect the reflexes to be? Absent. So it takes time to develop the upper motor neuron findings. So in an acute neurotrauma, the reflex exam is not as helpful. But there's other things that we need to confirm our suspicion, right? So here on the patellar tendon. And then I usually, when they're sitting in like a clinic chair like this, I'll usually like create a fulcrum because it's important just to relax, let your leg just kind of hang over my hand. Have you ever had me sit there? Okay. On those. So hers are gonna be hard to get either way.
So I don't have reflexes anymore. Come on, I practice for this.
Just relax.
Yeah.
So you just feel that patellar tendon. And with, I don't know if the tendon calcifies or if they just.
Take it out.
Yeah, yeah. So, but we can still do ankle, right? So, Achilles reflex, you want to dorsiflex, load that, that tendon. So. So what, so the Achilles reflex, they'll plantar flex like that.
What, okay. So it should go like
That
that.
part of the exam.
And then also important and maybe not so much hyperacute spinal cord injury, but you can check for like long track pathological reflexes. Do y'all know those?
Probably.
Do y'all know them?
What was the question?
The pathological reflexes. Yeah, like the upper motor neuron reflexes. Yeah, so can we take your shoes off? Okay. So to check the Babinski reflex, you are going to, you don't do it, you just lightly brush the bottom of their foot, you start lateral. And then as you come up, come medial, so.
Like that,
Mhm.
okay.
Well, yeah, well, no. It would only be present in people with spinal cord injury or stroke. But what's the abnormal? What is that?
Like, wouldn't the toes spiral or something?
Your toes would flare, you'd have an upgoing toe, that would be extensor. And
Which
then-
is normal in a baby, right?
Yeah,
Yeah.
until the age of, I think, 2. It
Okay.
usually goes away. I have a 3-year-old that I would just straighten the bottom of the foot at night. And then normal would be down going or just mute, no response at all.
If you haven't started doing experimentation on your toddler, you're missing out. Trust me. There are a lot of things you can do that are harmless but fun to watch.
Okay, so that's the reflex exam. What, did the exam change y'all's differential diagnosis at all? Where would you, if you wanted to tell the emergency room what imaging we need, where would y'all want to image? So let's,
Spine.
what is that?
Spine, lower
Mhm.
spine,
Where?
like lumbar slash brachial on the lumbar spine.
Yeah, I would probably do, depending on the exam, maybe get a thoracic, but my highest suspicion is cauda-equina, which would be, at that point, if that's confirmed on imaging, then that's a straight call to neurosurgery. But just to complete the exam, let's have her, you want to assess gait. In her clinical situation, she may not be able to. But like if you're seeing a patient, just to go over the comprehensive neuro exam, if you're seeing somebody in clinic, you want to check gait. So would you mind, can you stand up for us?
Okay, I might need something. Yep. Okay, all right.
Okay, and so can you just walk to me normal? Okay, and then coming back, so you want to assess their turn, because if you have a Parkinson's patient in the clinic, you want to assess it, just observe all that, but, okay, you can have a seat, but,
Okay.
in the clinic, I would also have them, like, tandem gait. I usually just say, can you walk like on a tightrope, and then heels and toes. So yeah, that's it wasn't very focused, but that's the complete neuro exam. In her case, it would be a real focus on the sensory exam, the motor exam, and depending on the acuity of it, the reflexes would play a more important role. You could also, there are other reflexes that will help you localize. You can check the abdominal reflex. You take the reflex hammer and start from the umbilicus and come down. In a normal response, it should kind of, I don't even know how to describe it, like follow your reflex hammer. I don't know how to explain it, but an absent one would point you towards, like, this is maybe a thoracic spine problem if it's absent. And then you can check the, which neurosurgery might do it, we never do it, like the anal reflex, yeah. But that's important in spinal cord injury. But typically, though, we're not the ones called about this stuff. It's neurosurgery that the emergency room's calling about these patients. So yeah, that's spinal cord injury.
I have a question. When you're suspicious of like an emergency such as this, would you bypass the upper body neuro exam just since you're somewhat sure and you kind of want to get her taken care of quicker? Would you bypass that, or is that kind of negligent?
I wouldn't bypass it altogether.
Okay.
But typically, in the rare instances, I've been the one that discovered like spinal cord pathology in the emergency room, like before neurosurgery was involved. Usually if it's a trauma case, they've already imaged everything anyway, and they're kind of, before you even see them. But no, I wouldn't, I would just be more focused in the lower extremity.
Okay.
I wouldn't ignore it. What other questions?
One question no one asked, but I don't think anyone asked. When you fell on the stairs, did you hit your head?
No, I did not.
Okay. Did you lose consciousness at any point?
I did not.
Okay. Did you strike your back on anything?
I don't know, but it sure is sore.
Sure, okay.
I don't really
Okay,
know.
that's
So
fine.
that's an important thing we didn't do an exam. So with spinal trauma, you wanted to check for point tenderness. So we should have checked her spine. And then we also should have done the pinprick exam right on the back, because that'll give us because with spinal cord injury, you're looking for a sensory level. That's the big exam finding. And if you do the pinprick all the way down the paraspinal area, that will give you the exact sensory level. Yeah, sorry. I missed that.
How would you check for tenderness on the spine?
Just so find their spinous processes and just palpate. Like, are you tender anywhere?
Not there.
How about down?
Oh, yeah.
In the lumbar spine. So you just palpate. If they have a spinal injury, they'll often have point tenderness.
What does caudal-equina syndrome like actually look like on imaging? Like, what are you looking for, and can it vary? Like, I don't know what it looks
So,
like.
usually it's like, so where does your spinal cord end?
That's-
Yeah, L1, L2. So I think the most common place for like caudal-equina, like lumbar injury is like L4, L5. Usually it's like a herniated disc. You'll have compression of the nerve roots on MRI. What else?
So what would the next steps be?
So, call neurosurgery. But they would need an MRI to confirm the diagnosis, and then they would take her for surgery.
Do they just decompress those nerves?
Can anybody tell me why it's MRI and not a CT?
Can't really see the spinal fluid / cord on CT.
There you go. Right.
CT is essentially just repeat X-ray, a series of X-rays. So it's good. You'll catch fractures on CT. It's good in neurology, stroke, but just for the sheer sake of like, we want to know is there blood in the brain, and blood will light up bright like bone. It's very you can't miss it on a CT scan. But otherwise, if it's not an acute stroke, then CT we really we need MRIs on most everything.
All right.
Thank you.
Yeah, y'all done?
Yes,
Can somebody swap with me? I want to be able to shoot the camera from the side, because I think that I'm missing some stuff. Yeah, the end seat should be just fine.
Really?
You want us to choose the next two?
We did that last time. Let's see. I'm gonna choose it. Just give me a second.
It's not bad. I'll let you finish.
I got it. All right.
So we all pick.
I picked the journal.
That's wow.
Oh, we take people?
Yeah.
Yeah, I'll take that. Hey, you got it. I knew it could pick on you.
We're not friends anymore.
But we are.
No, we're not. Hey, here's your pen.
Please.
Hey, how are you? My name is Max. I'm one of the student doctors. They'll be seeing you today. So what brings you in today?
I was in a car accident.
Oh, I'm sorry to hear that. When did that happen?
I think this morning,
You think this morning? Are you having trouble remembering it?
yes.
In the crash? Okay. So, what kind of, what are you feeling, or what symptoms are you feeling? Are you feeling any pain or any
A headache.
headache? Okay. Is it just in the head? Is it just headache, or is it any other part of the body?
Just, well, I'm hurting everywhere.
Everywhere, yeah.
Yeah.
Okay. Is it kind of a throbbing pain? Is it dull, sharp?
Dull.
Dull, okay. Kind of constant?
Yes.
Does it get, does it come in waves, or is it just consistent?
It's been constant
Okay.
since the accident.
Okay. Is there anything else that's been associated with it, like any eyesight issues or
The lights.
the lights bother you?
me,
Okay.
and sounds
Okay.
bother me.
What would you ask next?
So, in regard to like the headache, you can ask, where is it primarily located? Is it, you ask the character. You can ask, does it move anywhere? Does it go into her neck? Does she have neck pain? What's the severity of it? Just on clinical observation, you can ask questions like, what you think may be going on? Is she having any clear fluid coming from her nose or blood from her ears?
So if you had to rate your pain scale 1 to 10, 10 being highest, where would it be?
A 7.
A 7? Okay. Is it radiating anywhere? Like, is it radiating down your neck or any other part of your body? Just the head?
Right.
Does it localize? Or does it sit on any one spot, any one part of your
Yeah,
head?
Front of my head.
Front of your head? So you're not really feeling it like anywhere back here
No.
or on the sides?
No.
Okay. Let's see, you haven't had any runny nose,
No.
drainage, anything like that?
No.
Okay.
And then just anything else that may be caused by like vision, I think you asked about vision, but any weakness on one side of your body, any weakness, sensory changes, changes in coordination, anything like that.
Okay. Whenever you stand up, do you have any trouble like keeping balance?
Yes.
Okay. Do you have any like dizziness associated?
Yes.
Is there dizziness? Okay. Any, can you feel the front? I know you said pain, but like, can you feel this?
Yes.
So just to touch on, since you opened up the dizzy pathway, so in neurology, it's very important to clarify dizzy. Like, does she have vertiginous dizziness, or does she feel lightheaded? Like, have them clarify what type of dizziness they're feeling.
Okay. So when you say dizzy, do you feel like when you stand up, you're lightheaded, or is it more of the room is spinning?
The room is spinning.
Okay.
I feel dizzy.
And that will kind of lend itself to like more vertigo. Okay. Is there anything else that you've been feeling with the headache?
I feel nauseated.
Nauseated, okay. No, like lower body weakness, any like no issues walking other than the balance?
Well, I just feel weak.
You just feel, so you feel weak all over, okay. So even in your arms and your
Right.
legs, okay. I'm trying to think of other questions, or would we kind of move to a physical exam?
I'd ask her what led to the accident. Was she wearing a seatbelt? Was she,
Good check, was he?
yeah, things in that regard? Did she lose consciousness when she hit her head?
So during the accident, you said you have trouble remembering the accident.
Yes.
Were you wearing your seatbelt?
Yes.
Okay. Were you ejected from the car, or did you
No.
sit in the car? Okay. Did someone did someone hit you, or?
Yes.
Okay.
On the left driver's side.
Driver's side,
Mhm.
so driver's side, okay. Let's see. Do you know for certain, did you lose consciousness?
I did.
You did? Do you know how long? Did anyone tell you how long?
It was probably about 5 minutes.
5 minutes, okay. So you don't remember anything in that 5 minutes. What do you remember from the accident?
Just that I had gone to the grocery store and then a car I was turning and a car, ran a red light and hit my driver's side,
Okay. What's the next thing you remember after that?
waking up.
You just remember
in the
waking up
car.
in the car? Okay.
And then the ambulance came and got me out.
So you remember everything after that, but during those 5 minutes you were unconscious and you remember the hit, between there.
Correct.
Okay. Have you had any bleeding that you've noticed?
No.
Okay.
You might want to ask her if she remembers if her airbags deployed.
Did your airbags deploy?
They did.
They did, okay. Do you remember, so even though your airbags deployed, do you remember your head banging on any particular, hitting anything in particular?
I don't.
Okay.
So then I'd just go into like medical history.
Medical history.
Medical problems.
Okay. So do you, okay. Yeah, you wanna go?
I want to do the physical.
Okay.
Where did we go?
Asking about history.
Hey, my name is Lane. I'm another student doctor. I'm just gonna be a part of your team. What's your name?
Bettina
Bettina?
Tribbett.
Okay. My name's Lane, and so, I'm just gonna kind of take over here and ask you some more questions. Is that okay?
Yes.
Okay, so, Max was kind of updating me on everything. He said you were in a car accident.
Mhm.
Kind of told me what's going on. You're having a bad headache, is that right? And
Yes.
dizziness and a lot of things going on, right? So I'm just gonna ask you some more questions about your past medical history. Do you have any significant issues that you're aware of, like medically, hypertension, diabetes?
No.
No. Okay, have you had any surgeries?
Yes, I had my gallbladder removed 3 years ago.
Okay, 3 years ago. And have you had any trouble since then?
No.
No? Okay. And no head injuries in the past that you can think
No.
of? Okay. Are you taking any medications?
I mean, not really. I take ibuprofen or Tylenol if I have, pain.
Mm-hmm.
Getting older, I have more
you taken any today?
I have not.
Okay, alright, let's see. Family history, do we need to go into family history since it's like a trauma case, like, when you're like trying to go faster, I guess?
I mean, for your or your exam, like your medical student exam, you should. But yeah, that's some information you can get later. But I think for your sake, I think y'all probably need to.
Yep.
Like now, or?
For your.
Yeah, go
For
ahead.
your simulated patient
Yeah,
exam.
go ahead.
Okay, do you know anything about your family's medical history? Anything about your parents having hypertension, diabetes, or anything like that?
They didn't have anything like that. Both of them did have problems, with migraines.
Okay, but your mom and your dad did?
Correct.
Okay, do you have any children?
No,
Okay, siblings, do you know about do you have any siblings with
No.
issues? Okay, and social history, is that important right now too? Okay, so what do you do for a living?
I'm an insurance agent,
Okay, how long have you been doing that?
20 years.
20 years, okay. All right, so, and where are you from?
We live in Canton.
Okay, all right, and you're still working full-time and, okay. Do you currently drink alcohol
No,
or smoke any tobacco?
no,
Okay. Any illicit drug use?
no,
Prescriptions?
no,
Okay. Are you currently sexually active
with just my spouse.
with just your spouse? Okay, are you married?
Yes,
Okay. And have you been married previously?
no,
Okay. Am I missing anything right now? Social history? Do you want me to do review of systems before he does the?
I would.
Okay, review systems, okay. I'm gonna ask you a series of questions and kind of go through, make sure we're not missing anything, or any of your symptoms. So
Okay.
just gonna kind of start from the top and go down, and if you can, just bear with me through it, and kind of like yes or no answers, okay? So, you said your head was hurting, or have you had any changes in your vision?
no.
No changes in vision, okay?
I mean, other than the light bothers me.
Okay, all right, and dizziness?
Yes,
Dizziness, okay. What about hearing? Any changes in your hearing?
no,
Okay, let's see. Have you felt any weakness?
yes,
You do? Okay, where at?
all over.
Okay, arms,
Mhm.
legs, okay.
Yes.
Are you having trouble standing up, sitting down, walking?
Walking,
Okay, all right. Let's see, any changes in going to the bathroom since the accident? Any issues?
no,
Okay. Have you noticed, I see that you have some bruising on your face, or is there bruising anywhere else that we need to be aware of?
this left knee
Your left
has a
knee?
bruise,
Okay,
and, up here where the seatbelt got me, has a bruise.
okay. And do you have any pain radiating to your chest, any jaw pain,
No.
back pain?
No, I
Okay.
am tender up on my chest. but,
Okay. What about shortness of breath?
No,
No shortness of breath, okay. Let's see. No coughing, wheezing,
no,
nothing like that. Any stomach pain?
no,
No, okay. Am I missing anything?
I think that's good. I would just go, like the pertinent review of systems, like, did you say chest pain, like palpitations, like could
Well,
you have had?
palpitations, yeah. Have you had any palpitations? I know you said you haven't had chest pain, but palpitations?
no.
No, okay.
It's more just tender from,
Tenderness?
Yeah.
Okay, and you're able to take a deep breath if you need to?
Right.
Okay. Anything else that you can think of?
no.
No? Okay. All right. Well,
Okay, so, before we examine her, what is y'all's differential diagnosis? What do you think's going on? And could it be several things?
Brain bleed?
Yeah, that would be high up there.
concussion.
What about her, just like observing her on physical exam, like her appearance, what are you worried about? what
The
specifically?
bruising under the eyes is really concerning.
Yeah, for what?
Is it severe?
For a skull-base fracture.
Okay.
You'll have raccoon eyes, you'll have CSF leak. What else? She can't remember the event. She probably has a TBI, traumatic brain injury. What else could be going on? Some of her problems. It could be related to the TBI, but what's something, she's having, like
She's
room
having
spinning,
weakness, so-
dizziness, trauma. What specifically? What, besides like just a traumatic injury, what could it be? In a car crash?
Cervical spine injury.
Leading to what?
Nerve issues, sensory issues.
So, it's,
Like vestibulocochlear?
huh?
Like the vestibulocochlear?
Yeah, it's something in the brainstem, what would, or cerebellum. So it's not uncommon to see, and we get a lot of stroke patient, like arterial dissection, like if they dissect the vertebral artery in the car wreck and then have a subsequent stroke from it. So what imaging studies would you get on this patient?
CT.
Stat, CT, what else? CT of what?
Circles.
I'd say that.
They'd probably just get pan everything, imaging with trauma in a car wreck, but for our purposes, we want a CT head, CT angiogram to look for arterial injury, and a C-spine. Okay, and then let's do the exam. And I didn't mention this before, so with any trauma, the most important thing you will always start with on your exam is you need to make sure that ABCs are intact, because that will take precedence over anything. I didn't mention that in the first case, but certainly in this way, in a car wreck, like, you want to make sure ABCs are intact and then go into your neurological exam.
So what do you all think? Did she hit her head on something?
She said that the airbag came out and hit her, so,
Okay, so that's possible.
yeah, I mean, that
If she
definitely
got
can
hit
be
head on,
damage.
then blunt
Yeah.
force trauma would likely send some type of hit to the head, maybe, like the car can get on her side.
Right, remember the issue of, an impact causing the brain to slosh back and forth, okay? And that's often the point of actual injury, even though her head didn't touch anything necessarily, okay? But just the sharp, you know,
It's true function for injury. Okay.
So,
I'll examine it.
cranial nerve test is different from physical exam, or are they together?
No, that's combined. So cranial nerve exam in this patient is gonna be very important.
Right.
Because there's a high chance she could have high intracranial pressure, and so your pupil exam is gonna be very important. Yeah. I would focus more on as opposed to with the last case, we did like lower extremity motor and sensory exam. Your high focus here is gonna be like, you wanna check her mental status, her orientation. I would go further into the mental status exam. I would have them do like 1 and 3 minute word recall. You can ask them just to assess their attention. You can ask them, I'll ask the patient to ask, can you name the days of the week for me? And then have them go through Sunday through Saturday, and then I'll ask them to do it backwards, Sunday, Saturday, Friday, like that, and see, can they maintain attention on your exam, or are they going elsewhere? Can they not maintain attention long enough to do that?
How would you do the 1 minute word recall?
Just come up with 3 words, dog, pen, door, or my story.
Would say.
and then do a little bit more of your exam and come back and say, hey, what were those 3 words I asked you to remember? So yeah, just concentrate more on like the mental status orientation stuff and cranial nerve exam. And then, of course, I'm concerned about like a posterior circulation stroke as a result of arterial dissection, so I would go a little deeper into a cerebellar exam. I'll go through that with you.
Anybody have a light? How you doing today? What's your name?
Bettina Trippett.
Yes, ma'am, I'm Jadera Bryant, and I'm another student. Dr. gonna be helping assist you today, get you better. Today I'm trying to perform a physical exam on you. Is that fine?
Yes.
Okay. So first I'm gonna start off. You say your name is what again?
Bettina Trippett.
Okay, you know where you are today? Where are you?
I don't know.
You don't
I know
know.
an ambulance brought me here, and I've been waiting a while.
Okay. Do you know what year it is?
2023.
Okay then. So I want you to follow, look at my nose and follow my hand with your eyes only. Okay. And you said cover her eye and do.
Yeah, pupils are gonna be important on her, and it's something I'm gonna check like right away.
Okay. How would you do this? So besides just looking at her face?
Just so that people can do this brisk to light.
Okay.
That pupil's brisk to light. What should happen, that the light in their eyes should constrict, right?
Mhm.
And then we take away, it should dilate. So that's briskly reactive. That's briskly reactive. And then you can do this swinging flashlight test. But what is the worrisome finding here? What do you not want to see on this exam? On pupil exam?
Among people.
Yeah, so that's pupils.
Okay, and I want you to remember these 3 words when I'm actually later on: sun, park, and dog. Okay? And can you also recite the days of the week starting from Sunday?
But let her recite the words you asked her to.
Okay, like say it, then
Right.
ask her again.
So I would say, can you repeat the words back to me? Say dog, pen, door.
Dog, pen, door.
Okay.
And then I
so-
want you to hold on to those words, because I'm asking in just a minute, okay? To repeat them again.
Okay. And can you also say the days of the week starting from Sunday?
Sunday, Monday, Tuesday, Wednesday, Thursday, Friday, Saturday.
Could you do it backwards for me?
Saturday, Friday, Thursday, Wednesday, Tuesday, Monday, Sunday.
Okay, thank you. And I just forgot what you just told me to do.
And then, so generally you would do that before, just
Before we
organize your
start.
exam, yeah. So do orientation questions, tell me your name, where are you, what year is it, why are you here? When that would be important in her case, is checking language. So you want to assess for any evidence of aphasia. So you want to check their comprehension, their expression, and then their ability to repeat. So you can, I always say, can you repeat, can you repeat after me? Say, today is a sunny day.
Today is a sunny day.
I heard it on the radio.
I heard it on the radio.
Good. And can you tell me, what is this right here?
Watch,
What part of my watch is that right there?
fan,
And what about, what is this right here?
fingernail,
Good. And then with your left hand, can you show me 3 fingers? Good. So she was able to name objects, so she was able to, and you can also gauge language just in your conversing with her. She's appropriately conversing with you. And then she was comprehensions intact, repetitions intact. intact, so all three modalities of language are intact.
Okay.
And then you can, by this point, you can say, what were those three words I asked you? Do you remember?
Dog, hen, park.
I think you can combine them.
Okay, and then, so
I had a
from
hard
there,
time with that.
from there, pick up the cranial nerve exam.
Okay.
So you check your pupils.
Are you having any trouble smelling?
No.
Okay then. And the face. How you did the trigeminal and the facial?
So can you smile really big for me? Show me your teeth. Good. Close your eyes tight like you have soap in them. Tight, tight, tight. Good. Wrinkle your forehead like you're mad at me. Good. So that's 7. 5, you can just light touch. Does it feel the same on both sides?
Does it feel the same on both sides?
Yes.
Okay. And then
Did you already do intraocular movements? I think you did.
I did that first.
Okay, so you've checked, and then you can check visual fields.
So I'll just cover up eye.
Cover up, you just do one eye for the sake of time, but you want to do it to confrontation, meaning that you want to be eye level with them, and then use your visual fields, because whatever you can see, they should be able to see.
Put this down. So can you see this?
Yes.
What is it? How many fingers am I holding up?
Well, now I can actually.
Yeah, I don't
see.
think she'll.
Sorry.
So cover your eye here, and then, so for your temporal fields, they'll be out here, but your hand's covering.
So she can see.
Gotta remember your left is her right.
Okay. She says you can see it. Okay, let's try this again. Can you see this?
Yes.
How many fingers am I holding?
2.
How many fingers am I holding?
1. I can't see it.
You can't see
Can you
it.
see that far? I can't
3.
see.
Okay.
Yeah.
Try this again. Can you see how many fingers I'm holding up?
2. 3.
Okay.
But so you want to do it in all quadrants, though. So look right here at my
Okay.
nose,
Okay.
and how many fingers do you see?
1.
How many?
2.
How many?
3.
How many?
2.
And how many?
1.
Good.
Yep.
Always do 1, 2, or 5, because 3 and 4 can be hard to differentiate.
Okay.
Yeah.
And what else about this?
So you can check.
Trainer 11 and 12.
But if we're moving down, you can do 8 finger rub.
Okay. Can you hear my fingers?
Yes.
Okay.
Good. 9 would be palatal rise, so get your light.
Look at my mouth.
So you can do 9 and 12, 9 and 12 together. So
Okay.
I have them like, you stick out your tongue.
Can you stick out your tongue? Can you
Side to
wiggle
side.
it side to side?
And then say ah, and look
Say
at
ah.
and then shine your light, and you're, say
Can you
big,
let
big
your
ah.
tongue down? Yeah. Say ah.
Can you see your palate rise?
Say ah one more time. Yeah, I see it.
So it should be symmetrical.
Okay.
And then shoulder shrug.
Can you
So,
push against
by the
me?
last one.
Can you turn your neck other way? Okay.
So yeah, cranial nerve's good, intact. Pupils are intact, which is most important for our exam. So now motor, sensory, reflexes.
Okay. All the way done?
For
them over.
For motor, so start in the arms, have them check their deltoids, bring up the chicken wings, and then from the elbow, just, can you keep your arms up, don't let me push them down. Good, now push me down. Good, and then arms up like that, yeah.
Can you pull it towards you? All right, can you push against me? Okay.
Squeeze my hands.
Squeeze. Oh, squeeze my hand or?
Squeeze my hands, so grip strength is intact. You can check the wrist flexors, extensors.
All right, can you push against me? Can you push down?
Okay. Good. And then hip flexors.
Can you push your leg against me? I'll check the opposite way.
Knee extension, flexion.
Can you push your knees? Okay. Can you pull it?
And then plantar and dorsiflexion.
Can you, if you put up, can you press the gas? Can you push against me? Can you press the gas? Okay.
Good. And then sensory, so like, how much does that feel the same on each arm?
Yes.
Good. And then legs, and then
Does this feel the
Yes.
same? Does
Yes.
this feel the same?
good. In this patient, I'm not gonna do like proprioception and vibration and all that stuff, but I will do light touch and pinprick on everybody. So pretend this was a needle. Does that feel sharp?
Yes.
Does it feel the same on both
Yes.
sides? Good.
Does this feel sharp?
Yes,
Does this feel sharp?
Yes.
Does it feel the same on both sides?
yes,
Does this feel sharp?
yes,
Does this feel sharp?
yes,
Is it the same on both sides?
yes.
Okay.
Good. And then reflexes. So start in the biceps, just relax, and then you can feel right here. This the biceps in here.
You just swing it.
I usually keep my middle finger there and then just straighten the finger. Okay, and break your Alice is just in the muscle bulk there. Okay.
Kind of delayed.
And then, one thing that we didn't mention before, the pathological reflexes, so, the Babinski is your long tract, reflex, pathological reflex in the lower extremity. You can check a Hoffman's in the upper extremity, it's the upper extremity equivalent. And you take their middle finger and just stabilize it here with your thumb. Kind of just flick it down, and what I'm looking at is her thumb, a positive Hoffman, her thumb would adduct each time I, like give the flick of the middle finger right there. And then, so, that would be, if you're like cervical spine, if you're localizing the cervical spine, that would be something to focus on. Okay, so the lower extremity reflexes, find the patellar tendon.
Have you had knee surgery before?
No,
Okay. And I just strike it.
Oh.
Dr. Ladd, does that constitute hyperreflexia?
And then, to check the Achilles reflex, you would just, again, you always want to load the reflex, so you dorsiflex their foot and then strike their Achilles tendon. And it's sometimes a bit hard to get, it's easier in a hospital bed. And then, and then the next part on her exam that I'm personally interested in, want to rule out, I'll check her cerebellar function. So I'll ask them, with your index finger, can you touch your nose? And then touch my finger. And then go back to your nose and back to my finger. Good. So you're looking for any dysmetria on finger to nose. So with this finger, touch your nose, my finger. And back to your nose, back to my finger. It's important to have them extend their hand all the way out. Don't like bring it super close to where they just have to kind of. And then the second part of that is you can have them with your heel. Can you run it up and down the opposite shin there? And then the same on the other side. Good. And so you're looking for any dysmetria there. You can also look for like dysdiakinesia. And then same with the opposite hand. Bring your fingers big as fast as you can. Good. And then another thing, you can have them mirror. With cerebellar, they'll often overshoot. So you can have them take your index finger and then mirror my movements. And so just have them. And with cerebellar, I'm looking for somebody would when they come out, they would overshoot me. So yeah, and then if she was able to get out of bed and walk, you would assess her gait. Yeah, that's the more focused exam would be the mentation, the cranial nerve exam. Make sure she's not showing any signs of elevated intracranial pressure. Because that again is a neurosurgical emergency, and yeah. But my biggest suspicion would be for traumatic brain injury and rule out skull-base fracture, just based on exam. Anything else? Questions?
Okay. My general reactions to this is that those were a lot of tests.
Mhm.
How do you keep it all straight?
What do you mean?
Like-
remembering the exam?
Like, I mean, just like, because we've done it twice and they were like two kind of different like directions in which it went into.
Mhm.
And it just seems like a lot to
So-
do. So like, how do you like keep it straight for like, you know, from, like as a student?
It's harder for a student. I mean, it's something you just need to gain experience with. Even interns and PGY2s are doing, you learn to tailor your exam to the patient's presentation just through experience and seeing patients. I probably should have focused more on the focality of the exam. But for y'all's purposes, I think it's important, because if y'all get a neurology case on your CSA, like, I think the examiners are looking for like a full exam at y'all's level. But in each case, the first exam, if I'm seeing the patient at bedside as a neurology resident, I'm gonna focus on the first case, more of the lower extremity sensory exam, motor exam. Rule out things that would lead me further up the spine. That's why you can't skip the arms or anything, but based on the chief complaint, I'm gonna tailor the exam and go from there. But if there's anything else that lets me know, I need to also image the cervical spine if I find anything. If I don't examine it, then I could be missing something above that lesion. And then for this case, it's gonna be more mental status, cranial nerve exam. I'm concerned for a traumatic brain injury based on just my observation of the patient. I'm concerned for a skull-base fracture. So her exam is gonna be more tailored for brain stuff, if that makes sense.
Yeah, thank you.
Mhm.
Yeah, remember, in these exams, as Dr. Ladd is saying, we're kind of overshooting on how much exam we would do. Obviously, in an emergency situation, you're gonna zero in pretty quickly. You're not gonna spend a lot of time, for example, in her case, looking for lower extremity problems, unless something tips you off higher up to look further down. But part of the purpose of this is to get you a little more comfortable with the process of going through the exam. And, you know, you were asking how to keep it straight. One of the things that when I was directing the psychiatry clerkship, I used to tell people, it's okay to keep a cheat sheet. I mean, I used to pass out to them a form for a psychiatric mental status exam. Because you're right, it is complex. I mean, you know, the full mental status exam in psychiatry involves 15, 20 elements, something like that. And unless you do it every day, you're not gonna remember that. So nobody's gonna jump all over you if you have something to cheat with.
It's important. I mean, when I was starting off PGY2, I would have a note card for every patient and have to write down their exam, because it's important. You don't want to miss anything.
Right.
When you're staffing with your attending, that you don't want to like miss any red flag findings on your exam.
Right.
And again, that's just something you gain with experience. In seeing patients, you can focus in on what was the important part of that exam, and you'll know more of like what you're looking for in that sense. And if you find anything like red flag findings, you're not going to forget it.
Right.
Okay,
Yeah.
thank you.
Sure. Okay. Are you wrapped up?
I don't have anything else. Do y'all have any questions?
Okay. Thank you so much.
Of course.
Thank
You're welcome.
Good luck to y'all.
This is a beautiful
Oh,
case.
thank you, thank you. Have a good day.
You too.